It's doing drug math. All right.
That beer.
Yeah.
Beer.
I can't. She's too cute.
Yeah, you put her both. Yeah.
The beer. The beer.
All right. So we're gonna.
She wants a beer. What?
She's saying bear, not beer.
And here we are thinking you're teaching her right. All right. So, you guys are seeing the share.
Yes.
All right. So, question 1, you guys are good. Just make sure that you know the difference, the different vessels. So, which one is an arterial bleed, and which one is a venous bleed? Yes. No smiley faces. This is kind of cool and creepy all at the same time. Question 2, you're on point. Question 3, definitely focus on the pink. Question.
Wait, is that document live from that we all can see, or?
I think so, because
I'm
whoever's an anonymous llama
right
was
now, like, put little
updating.
notes in.
I think it's
Okay.
I think it's Ashley. Yeah, she's
I
definitely the
started the
anonymous
paint.
llama. She's got a secretary and everything. Disentanglement, that's accurate. 5. Hold on. Come on. There you go. That's where your emphasis should lie.
Carbon dioxide.
Carbon dioxide. So if you have a patient where there's no quote unquote specific treatment, what should you do?
RMA.
You know.
Sorry.
You do monitor the patient, reassess every,
Check everything? Or recheck everything?
You perform a primary survey.
BLS. Your BLS before ALS.
Yeah, your ABCs, right?
ABCs.
Maintain your
So
ABCs.
you don't do anything, just monitor them and just reassess.
Yep. And well, what can you administer? BLS. Oxygen. Perfect. So as interesting as this is in terms of the neurogenesis, the overall answer is no. The brain does not regenerate itself. It does not. It will create new pathways, but it will not replace the neurons that were damaged.
Wouldn't it be just the use of neuroplasticity versus like the actual regeneration?
Yes, exactly. You will have like, so for example, this part of my brain, like in the frontal lobe that gives you smell, that olfactory bulb, is gone, is dead. But it's even a little more accurate here. This part of my temporal lobe where I had my TBI, it shows up as like a dead spot on the CAT scan. Okay. However, I don't have issues with time and stuff because my brain has created new pathways. The neuron itself is dead, but the pathways of neuroplasticity that Brianna was talking about is alive and well and creating new pathways. It doesn't do that with smell exactly, but
so it creates new pathways.
It's like when you do, when someone has a stroke and they do the physical therapy, like the speech therapy and stuff, to help them regain that ability to speak.
Yes. But if the specific question is regarding tissues of the brain, the answer is no, it will not be reproduced. I thought that
put
said,
all of that.
I thought this said neurogenic sprouts for a second, and I was like, I need to know more about neurogenic sprouts. Okay. Only thing I would add to this. Yeah, this is good. So if this is the opposite of what you're expecting, right? So if you have a patient who is in hypovolemic shock, you would expect them to be tachycardic, hypotensive, um, low, inappropriate pulse pressure, AMS,
Low perfusion.
Yep, low perfusion with cool, clammy skin, perhaps attack tachypnic, and slow capillary refill. Would you note anything about their pupils?
It would be
Sluggish.
slow. They'd be sluggish. No?
Maybe. I mean, if they're depends on what kind of shock, but for the most part, you wouldn't note, for example, dilated or constricted pupils, would you?
Would they be dilated in hypovolemic
They-
shock?
Not necessarily.
Mm.
It's not a standard sign or symptom.
I was gonna say like the only thing I think about with the eyes is maybe they might be like sluggish just because you know, the lower volume of blood. You know,
Yeah.
you're not getting as much oxygen to the brain. It's not functioning as well.
Yeah.
Yep.
But in the grand scheme of things,
That's not an indication.
it's not exactly. It's not the be all tell all. If a patient is got constricted pupils, they're not necessarily in shock. They could just be having a narcotic overdose or a pontine bleed, or anything to that effect. So, this dog's just running back and forth. So, just keep that in mind. This is not like the be all and tell all of whatchamacallit.
Nicole, are you recording?
Yes. I made sure to clear my disk space too, because
Yee.
it's always a problem. Like if 50 minutes in, you're like, your disk space is full. I'm like, curses. Oh, that was already bold. There you go. Good. More specifically here, I'm not sure if this is in the textbook. So highest triage, what's your highest triage? Which color, first of all?
Red.
Red.
Okay. What is a good sign? What is a good external sign of shock in a patient who's experienced trauma?
Blood. Loss of blood.
Moving on. There you go. Okay, hold on, we're at 12. Right, so we understand that in terms of heart failure, it becomes congestive when the fluid starts to back up, right? That's the C part of it, why it's congestion. Because you can have a patient who's in heart failure who is not congested, right? It's maybe their heart's pumping just effectively enough where it's moving things around. All right, Mack versus Miller.
Matt goes into molecular, the Miller goes and you lift the epiglottis.
Yes, I'm just going to add.
My words are not very good.
That's okay. It's late at night. I think it's Thursday. Sometimes it's Friday in my head.
You know what Thursday is?
No.
It's Thirsty Thursday.
Ooh, I'm waiting for my wine to make it across the room. Also, I like how you pre-gamed with an entire giant glass of water prior. I noticed that. I was like, oh look, Jonathan's really thirsty. Now I know why.
I've learned.
He's planned ahead. So what's a good sign or symptom of
I love how Nicole just deletes the whole big ass chart.
No, it just moved down. Did I delete it? No, I just moved down.
Oh, sorry. It looked like you deleted it.
You made me nervous for a second. I was like, I don't want to delete that. That's perfect. That's exactly what I want you to know. Just memorize the freaking chart. Because you're going to need to know that for the final and the state. Though that chart, super important. If you have an anxious patient who has suffered trauma, but you have no external blood.
Internal blood?
¿Dónde está la sangre? En el estómago. And that's the extent of my Spanish. I Spanglished the hell out of a patient assessment the other day, and this lady's looking at me like, yo. And I'm like, and then the student was like, I'm like, you could have opened with this. Opened with the fact that you knew Spanish, bro. He's like, I really don't know it that well. I'm like, you heard me struggle for 15 minutes trying to talk to this lady about where her chest pain is. ¿Dónde está en su pecho es su dolor? And she's like, I kind of know what you mean. I'm like, mastica aspirina. And she's like, yeah, Jody, exactly. That's exactly. It was bad. It was super, super white girl. I'm like, I'm gonna go on Duolingo and go brush up on my Spanish now. Bad. All right, acid base. Just note this one. No, this right here. Ideal. Good chart. Hold on. This other one. pH, acidosis, alkalosis. Also very good chart. These are two very good charts. This one, this top here, that's succinct and accurate. $17, perfect. I'm just going to add a little bit to this. That's just your keyword. You may be seeing that pop up. $19's on point. 20. On point. Hi, puppy. Okay, so I like how you guys like literally quoted me. Like, what numbers are you getting? So when you're palpating a blood pressure, when do you note what the systolic is?
When you first feel that first pulse.
Oh, I have it in caps lock already.
And isn't it if you can feel the pulse, you can feel a pulse in your carotid, femoral, and radial, it's going to be about like what, 75, 80?
If you have all three, it's going to be about 90.
Oh, 90, okay.
So I think it's 60, femoral 70, radials 80. But it also depends on which textbook you're reading, because I've had a textbook where it's 90, 80 in the femoral, 70 in the carotid. But the carotid is, you can get pretty low, but sometimes if it's really, really low, you might not be able to feel it, but the patient's still awake. You know what I mean? So you're like,
You're like,
ah.
is there a pulse?
Yeah, exactly. You're like,
You talking to me right now?
I think I feel it. If you can keep talking to me, then we're good. Okay, yep, math question.
Boo.
Boo.
Actually, I think everyone's pretty good on math now.
I think you guys have kind of solidified yourselves on math.
Zach's like the math pro now.
Is he here?
No, he's not. But
He's
he gets
not. When he
all
watches
like,
the recording later, we'll tell him that here at 16 minutes on the nose, he's getting a compliment on math. 23 is on point. 24 is correct. 25. Who's in a burning airplane? Who writes this textbook?
respiratory compromise.
Yeah, however you spell that.
Respiratory. You're probably going to be intubating this person.
.26 is on point. Who wrote in yellow? That's rude.
It says, oh,
I like also who
cold tip.
sips wine. Yeah. Sipping wine again.
You should talk to Edward about complications with chest compressions.
Oh no, what
Boom.
happened? What
I make boom.
happened? No. Y'all are rude. Also, sidebar, in regards to compressions and using the Lucas device, the Lucas device should not be put on patients who are 90 pounds or less. It will
Who
do
did that?
severe issues. Just not, yo. It's bad. It's bad.
Oh, God.
Yeah. 28. Yo, we rambled on for 28, didn't we? $29, yes. 30's good. 31, good. 32. I still have cap locks on. God damn it. $33 is good. 34. Now I can't. Come on.
34.
Uh, 35. Uh, This one you should definitely 36. I'm gonna highlight that in this horrible pink color. That know which valves are which. Oh, that's worse. Ugh. Know which valves. What are your atrioventricular and what are your semilunar? Know the names of them.
The tricuspid and the mitral.
Is which one?
Atrioventricular, and then the pulmonary and aortic.
38's good. 39. Yep. 40. Ooh. Emphasis. Good. 41's good. 42.
Say dry skin for heat stroke, right?
Usually. They keep changing like where the kind of cutoff is for heat stroke in regards to sweating, because sometimes you do have patients who will be in the heat stroke phase where they have the mental status changes, but they're still sweating, or they're still moist, right? So like sometimes it's hard to tell if they're actively sweating or if they've just been wet for a while because they were sweating. But I'm gonna just add that one. 43 is good. 44 is good. 45. Oh, it didn't work. Fuck. Wrong shortcut. Good evening. Thank you. Go away.
Position of function.
There you go. I'm gonna fuck it up again. There you go. I'm having a issue. Emphasis on properly. Okay, 47, yes, you're on the right track there. Just again, make sure that you can follow a drop of blood through the body. So if I was to tell you, okay, you've got blood in the inferior vena cava, is it oxygenated or deoxygenated?
Deoxygenated.
Yeah, good. 48, good. Good. 50. If you have a patient who has a cap refill of greater than 2 seconds, which color are they?
Yellow.
Red.
Damn. Oh,
I would say yellow. But isn't cap refill like a bad indicator of like perfusion for adults?
Yeah. But they still use it in the start triage system.
Oh.
I'd say like if it's an elderly or older person, don't use it, like consider it as reliable.
Yeah.
They always told me, I took uh, a rescue task force training up in Oriskany, and they told us like when we were doing like rapid triage, use like the RPM system, like respirations, pulse, and mental status. If any one of those is compromised, then it's a red.
Yeah. So if you actually see in this chart right here, it actually does point out. So if you get to right, so you have a patient who has respirations, yes. They're under 30, cool. You move on to perfusion. Is there a radial pulse? No. How about cap refill? If it's over 2 seconds, they're in immediate. So, as I said, another good start triage chart to have. The state test also really likes triage.
I recommend that course for anyone, by the way. It's really good.
Which course is that again?
It's the rescue task force training up in Oriskany at the Department of Homeland Security thing. Whatever, it was free for my agency for me to like go there and spend like the weekend. They put you up at like a nice hotel.
Nice.
And they have like military guys that like train you, and you do like life scenarios that like a whole town and shit.
That's so cool. Other things that you can also sign up for that are free. Excuse me. FEMA training. You can actually go down to Alabama, I believe. There's a military base in Alabama where FEMA does their training, and you can actually like learn how to do a lot of like the donning and doffing and dealing with radioactive substances and like sarin and all this other shit. Like they'll train you how to do that.
Is that the one where they use like live viruses, like legit crazy stuff?
Yeah, like
Actual
legit.
sarin gas on you, and you have to.
Yeah, it's like I'm gonna teach you how to really pee up.
We're gonna find out if you donned as well as you thought you did.
I'm sorry, sir, but you contracted the virus.
Oh Lord. Okay. 51. Yeah. I could tell which lawyer in this class actually answered that. So
Depends on how you document it.
It depends on how you document it. However, you should make you fear for your safety and decide not to treat or transport. You should make every effort to bring the patient with you, or be able to return to the scene. Thank you.
So like, if police aren't there, call the police.
Exactly. You can't just be like, patient arm aid, 93 refusal, and like just dip. Like you have to make every effort to treat the patient. So in this scenario, it would be unethical and illegal. I think it's also, if I specified, so your patient has a contagious disease. It's not that the scene is not safe. The patient has a contagious disease. So, for example, you have a COVID patient, right? And you decide, yeah, you're unstable, but I don't want to treat you or transport you because I'm afraid that if I start an IV, I'm going to get the COVID too. That's where I think, if it was like, oh, hey, this guy got shot in the face and the scene's not safe, there's no cops, and the perp is still on scene, then sure, please don't treat or transport. Sidebar, if he's been shot in the face and there's brains everywhere, this is not a viable patient. Please do not transport. That's a crime scene. Don't make the cops hate you.
You start CPR, right?
That's what we did. I'm sorry.
Only if he's still breathing. Because I had a guy who shot himself in the face, and the guy was still not only still breathing, but he was also still at a pulse. It was like,
It's actually pretty amazing how many people can survive with a gunshot wound to the head, though.
It's because they do it wrong.
Yeah.
I mean, it sounds terrible, but it's because they do it wrong if they're trying to do it themselves. Again, remember, the whole front of your brain and your face is not like super essential. It's the important parts straight back from your mouth where your brainstem is. Because once you kill, if your brainstem is intact, your body's still going to have a heartbeat, and it's still going to breathe, even if you're not, there. Even if you've just decided to turn yourself into celery. So.
Because people like they do the whole temple thing, and then they like flinch, or when they, it goes up here or whatever,
Or just in the front, yeah.
Front,
Yeah.
And they're just
celery, just celery. Or like you say, they're just an emotional cucumber, because humans and cucumbers have about the same amount of water. What's Danny drinking? Because Danny's having way more fun than the rest of us.
They're emotional people.
Humans are just emotional cucumbers.
That should have been like our patch, like mascot logo, whatever. Cucumber.
Yep, emotional cucumber with COVID. Being attacked by a honey badger. All right, where we go. 52. Perfect. 52, perfect. Signs and symptoms: preeclampsia, headache, blurred vision, and I'm just gonna. Sorry, I'm getting more wine. I'm just gonna add to this.
Hypertension.
Sorry, what?
Hypertension.
Yep. Not
Those are all signs, but they're not. Yeah, or symptoms.
Just adding, well, signs and symptoms. Yeah, so just adding to that one a little bit. 54. Uh, 55. Yeah, know your ICS. I never know my ICS. I always get that question wrong. Command officer. Correct. 56 on point. 57. What is a contagious sign of liver disease? It's contagious cause of liver disease, not sign. I'll get it right.
Hepatitis.
Mudda bomba. Hepatitis. Also. Very contagious hepatitis.
Is hepatitis?
Yep. 58's on point. 59, good. 60, good. 61. Yep, perfect. 62. Yes, or esophagus. Yep, surfactant. I'm just gonna add to. I like mid-face instability. That sounds like a great metal band. Hemoglobin, good. 66. Sniffing position, good. 67. Blood pressure changes, good. 68 hydrogen ions, good. 69. That's the perfect little chart. Just understanding those things. Good. 70. Good. Someone mathed wrong. Or the answer is wrong on this. Now we need a pen. Good news. I have a bag of pens. Let's do math real quick.
Six.
So it's like 80 kilograms, right?
Mm-hmm.
Mm-hmm.
No, hold up. Yeah, it might be 4 mLs. I think that's right.
No.
Okay. Yeah, that has, I don't know, so
Because
have
there's
ML.
a
Each
part
ML has
there's a part
what?
missing.
Yeah, I don't think they converted the 100.
Oh, there's a part missing. That's why it's wrong. Oh, 0.75. Okay.
Yeah, the 100, the 5 divided by 100 part.
Yes, sir. So whatever 0.75 times 80 is.
Yeah, it's 4.
So wait.
The answer is correct. He's missing a part.
It's this
So
part.
No, the answer's wrong. It's 3, bro.
No, I think what he did was that he did 5 divided by 100, which comes out to 0.05, and he times it by 80.
Should be 100 divided by 5, which is 20.
No, it should be 5 divided by 100.
Here, ready? So this is right. 176 is 80. This is
That's right. Yeah.
Hold on, I'm
Where
gonna
am I
highlight in
gonna-
orange maybe if my thing works. Okay, that's right. But
1
then
milligram.
you need to figure out how many you're administering. So it's 80 times
Times 0.075.
0.75.
It's 60.
Equals
It's 3
60
mLs.
milligrams, and then you go to your mLs, which is
Yeah.
in 3 ml.
Oh,
Boom.
sorry, I
So
didn't
yeah,
see the 0.5 part in the top. Sorry.
no, because I just added it. So because
Yeah.
it didn't
Okay.
come through on the.
Wait, can you guys hear me?
Yeah.
Yeah.
Oh, okay, cool.
Just
Yeah, 'cause
ignoring you.
So get rid
I
of the
did.
1 milligram per kilogram dose. That's the part that messed people up.
Yeah. The
Yeah,
dosing
because
wasn't there.
I did 5 divided by 100, which comes out to 0.05, and I times that by 80,
You got to do
which
100
comes out
divided
to
by
4.
5.
I mean, everything
But
else is right.
wouldn't that be 5? Wouldn't that be 100 divided by 5?
Yeah, it's 5 milliliter syringe that has 100 milligrams of
each
lidocaine, the whole thing.
Each ml is 20.
Yeah.
Yeah.
They give you 20 mLs, 20 milligrams per ml.
Ah, shit, I did that wrong. That's my bad.
No, you did it right. You just
Yeah.
didn't have the other information of what the actual dose for the
The
patient was supposed to be.
0.75 part. Gotcha. All right, I was like, wait a minute, did I do that wrong?
No, you did not.
Okay.
I am in sub Q. Good. This is not right though.
Oh, they're asking you the drip rate if you put it like in 100 ml bag over 10 minutes.
Yeah.
Oh, okay. So that's gonna be volume 100 over time, 10 minutes.
It's 10 drops
It's gonna
per
be
second.
10 drops a second.
Chris got
Or 600 drops a minute.
Mm-hmm.
So if you put 2 grams, so it's volume over time times your drip set. So if you're using your volume is 100 over 10 times your drip set is 60, that doesn't work. That's 10 times 60 is equals 600. If you're doing it in a 50 drop set, so you have 50 divided by 10 times 60 is
So
300.
5 times 60 is 3,300.
Now, if you're putting 50 and you're running it over 20 minutes times 60, what's your drip rate?
Oh, it just halves, doesn't it? Because you doubled the time, so you have it. Yeah, 150. Yep. Wait, Nicole. So all 4 answers are correct?
It depends. Yeah. So it depends on what bag you're using, what size bag, how long.
Okay, cool.
Just know it's volume divided by time, and
yeah.
then times your drip rate.
74. Good. Good. 76. Going to add to this.
Mm.
77's on point. 78. Just want to draw your attention to that one. Good. Yep. All right, so if we have a patient who has anterior face and neck, chest and abdomen, and anterior surfaces of both arms, what's your percentage?
Anterior face and neck, you said?
54.
Anterior face, neck, chest, abdomen, and arms.
So 36.
54, 50 something.
Wait, I didn't hear the question.
Bless you, whoever that is.
He said, bless you, baby.
54?
So 54?
No.
Wait, so what's the question again, Nicole? Sorry.
If you have a patient who has, hold on, I'm going to write them in.
I got this.
49 and a half.
Nope.
No.
I just remember it was anterior face.
Anterior? Okay, so that's just 4.5.
4.5 plus.
That's why. Yeah.
What's the neck? Another 4.5?
The neck is part of the front and back.
That's right.
Or, yeah, part of the front.
So you have your anterior face and neck.
So that's 9.
So it's 4.5.
Plus 9 plus 9.
Plus 18.
Plus 4.5.
4.5 plus 18.
31.5.
Plus 4.5 and 4.5.
8 plus 8 is 2.2.
It's 30,
30.5.
31.5.
Yep.
Yeah, got the same thing.
Yamada.
Easy day. Nicole, I have a question about this.
Yeah.
So I was told by one of the instructors in school that if they have like burn marks randomly throughout like certain body parts, you can use their hand to measure
1%.
1% of each of those like affected parts.
Yes, but it has to be their hand, not your hand.
Okay, yeah.
Yeah.
Okay, cool.
Unless you'd like do like a, okay, we're good, the same size, and then use yours. But yeah, so
We're the same size.
does your hand fit in this glove? Yeah.
Gotcha.
So yes, you can. So if there's
That's the whole hand or just like the palm?
just the palm. So like this
Just the
square,
palm, okay.
the square
Yeah.
part, not including fingers, would be 1%.
Gotcha.
The amount that covers the other 1%. All right, cool. So pediatrics. So if you had a kid, come on, who had entire, oh, no, I don't want, undo, entire head and neck and right arm.
So how old's the kid?
Old enough for this. Infant.
Oh, infant. Okay.
Is it head, neck, and right arm?
Entire head and neck and right arm.
So 12 plus 9. So is it 20?
No. You're looking at infant, so it would be 18.
Oh, 18.
18.
Plus 9.
Plus 9. Okay, so 27. Easy day. Okay.
The easiest math you're going to do. As long as you can remember it. 82. Perfect. I'm just going to throw in a all right. Emphasis. $84. All right, so no one actually answered 84.
If a tourniquet fits, I love this one.
It would be acidic.
And what else?
Secondary to hemolysis.
Why is it acidic?
Because
the
it's
blood cells broke up.
Is it
Because
able
it's
to get?
the CO2 is building up. That's why, isn't it?
Yep, but because why is the CO2 building up?
Compartment syndrome.
Because it's not letting the blood go back to the heart to get filtered out.
So if it's not going back to the if it's not going back to the heart, is it coming down to the leg?
It is not.
Which means it's not bringing what?
It's not bringing oxygen back. So there's no perfusion. So you get hypoxic. So
yeah, it's bringing whatever oxygenated blood you had, but then you have all the after it metabolizes, you have all those waste products, and it just keeps accumulating.
Exactly.
Exactly. And it's the same thing that happens with compartment syndrome, which is, compressive forces, so crush syndrome. So if you have somebody who, is underneath like a cement wall, and you release that pressure, you're going to send all the acidic and hypoxic blood back to the heart and cause all sorts of problems. And that
That's why you
patient,
need to get your IVs in before you
exactly,
do that.
and get your bicarb going. Exactly. 87. Just going to add to this list. $88. Okay. Emphasis. Good. Oxygen exchange. But good. No one did this one.
Which one?
91.
Regards to
Oh wait, maybe they did. Nope. Is that kind of purpley black gray?
that bitch may have low.
Yeah, I think they answered it.
Okay.
Now I don't know if that's correct.
It is.
Okay, cool beans.
Perfect. 92. Perfect. Emphasis.
That's where you have them say like supercalifragilisticexpialidocious, right?
Yeah.
Yeah.
So stridor is upper airway, and it's not caused by narrowing.
Narrowing of the airways.
Narrowing.
Which airways is this talking about?
Easing.
Any.
Strider is
called-
So
like
basically, think about your trachea and your bronchioles have
Yeah. What?
cartilage rings. I'm sorry, I was
Yeah.
speaking
Okay.
it out. So those don't constrict, whereas your smaller airways have no cartilage, so they can get much smaller and kind of collapse upon themselves. And that's where you get the wheezing sound from. So if you have narrowing of the airways, it's like
Has to be wheezing.
almost.
Strider is like an obstruction.
Yeah, exactly. Stridor is an obstruction or a tongue, which again is obstruction, but okay. Unconscious patient with snoring.
Shouldn't you check the tongue? Opioid overdose. Oh, okay. Yeah, upper airway obstruction.
Hi, Roger. Uh,
rapidly deteriorating mental status and a patient complaining of chest pain.
Chest pain and vomiting.
Vomiting, if they're rapidly deteriorating, you're going to intubate this patient because you need to protect the airway.
What?
Why would you go for nitro and all that stuff?
No, that's not wrong. That's not wrong in the grand scheme. This is one of those like, all right, so if your options were pneumonia, status asthmaticus, carbon monoxide, or ammonium inhalation, which would most appropriately fit a vomiting patient with a deteriorating mental status with chest pain and a headache?
Carbon monoxide.
Monoxide.
Yep.
I'm gonna go with Joni on the monoxide.
So slap that non-rub breather on them.
Yup.
Crank it up.
Okay. Good. Blood flow of the heart again. Good. Because that's like 4 questions. $99. Perfect. Cardiac output. Make sure you know. Make sure you know that. Oh God, that's violent on the eyeballs. Put that up there. It hurts my eyes. Did anyone do the cardiac plexus?
Which number? What number is that again?
I don't know if here it is. No, that's not it. I'm just gonna add it in here. Oh, I think it goes here.
This is innervate the heart.
Emphasis. Okay, so if the vagus nerve, for example, is stimulated by the release of its neurotransmitter, what will happen?
The vagus nerve. Heart rate decreases.
Vagal.
You go vasovagal, and does your blood pressure goes down too, doesn't it?
That's your answer. Someone else type that in there for 105. Because I'm gonna drink more wine.
You're here.
Also,
Don't you
that's
also
it.
syncopize
Yes,
if you
potentially.
overstimulate?
Potentially, if
Yeah.
you bottom
That's
yourself
how
out
old
enough.
people. That's how old people die, right? Like some of them in the bathroom sometimes.
Oh yeah. Oh, 100%.
They go into a
100%.
rest.
Yep, and then they find that like sweet spot between the tub and the toilet.
Nice.
Like magic.
And then defecate everywhere.
Yeah, it's just hours of fun.
I had a DOA like that when I did my BLS rotations. Between the toilet and the tub, he was actually like
The Bermuda bathroom triangle.
and I guess apparently stood up and then was like ass up in the tub, like between. I don't know. Yeah. So I had to go check him.
I think one of the weirdest DOAs I've ever had was the guy. It was a younger guy too. He was like maybe 38. He wasn't feeling well. He went to bed and he clearly like wrapped himself in the sheet, kind of like this. And he was I think a larger dude. When we got there, he was a few days ripe.
Is this summertime?
Yep. And
Ooh.
he was very bloated, where his body looked like a sausage in a casing in his bed sheet. But the bed sheet was just tight enough where it was actually kind of compressing him, so the gas in his stomach from the bacteria overpopulating was actually creating like this bubbly fountain of like goop out of his nose. So you're sitting there like real quiet and you just hear like blip, 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 blip. And I'm like, what the fuck is that noise? And I'm like, it's his, he was degassing through his nose. And I was like, we gotta go. It's time.
That's when Nicole looks at her partner and go like, "Yeah, I can't smell, bitches."
Yeah, pretty much. Oh, we had one. The guy was on the 4th or 5th floor. He was there for a few weeks in the summer, and the whole apartment building smelled, apparently, from what I told. Where like you walked into the lobby and my partner was like, "Oh yeah, no, he's dead," and I'm like, "Is he?" Oh. And yeah, because I'm not that sick. The cops were like, "Can we go now?" We're like, "No, he's all yours. Like you want to sit on that till the ME shows up." And
So
he
let
was
me
just
go outside and get a branch to poke him with it.
so no. I'm the person who's like, "Listen, medic student, come. See this right here? This yeah, I'm not. I had a really good one once for like a
I feel like you'd
CSI
be like,
case.
oh, you gotta start CPR on this guy.
No, he was not a black man, but he was charcoal black. Like it was bad. We had this one a girl hung herself, but she hung herself from the doorknob. So it's one of the most effective ways, unfortunately, to hang yourself. So she tied like this thin string around her neck, like multiple times to make a thicker ligature, tied it around the doorknob, and just sat down. So when she sat, her arms fell by her sides, and that's how she died. So fire had cut her down, and they laid her down, and as they laid her down, her arms were up. So it was like she was in full rigor. You're like, oh yeah, no, she's dead. So like we pulled the sheet off to confirm because they had covered her and everything, and I'm like, oh, this is interesting. So I'm like, medic student, and there's a cop standing there like, what is this chick doing? I'm like, look. If you look in her eyes, you can see the petechia. So kind of going back to the putting a tourniquet on, the same thing happens when someone hangs themselves is that blood builds up in their head, right? But usually what happens is it's enough to get in, but then it can't get back out. So the pressure builds up in a person's head, and the most common spot that you'll see the petechia, which is
Bulging.
like the bulging, is in the eyes. So there's like these little bruises in the eyeballs that you can see. And then I was like, all right, so now look at her fingers, because in between her fingers there were strands of hair. It looked like she'd had her hair down, and she looked like she was trying to get the ligature, and she was just ripping her own hair out. So she had her own hair like between her fingers, and the cop is looking at me like, why do you know this? And I'm like, nerd, sorry. So yeah, it was pretty wild. Like, and like she had all subcutaneous
The little
emphysema.
details, I guess.
Guess she was like, oh, I don't want to kill myself anymore. Too late.
No, so the thing is, your brain
Got a fight.
is pretty incredible. So you might be the most depressed person in the world, but the second your brain's like, "Excuse me, where is my oxygen?" it will do everything in its power to stop you from hurting yourself. So it's her brain, just her reptilian brain, just totally took over and was trying to save her, or save itself. It didn't really matter what fleshy body it was in. It just didn't want to die. So kind of cool. Your brain's wild. All right. After that fun little trek to suicide.
Yeah.
All right.
Silence.
It's the answer. Let's see.
Does someone just inhale like helium?
I didn't answer. Wait, are we on what 106?
Yeah, we're on 106. All right.
Weak and complaining of severe substernal chest pain.
So
you treat?
Yes. This is
See the
the
doctor.
heart rate does indicate that this patient's experiencing SVT. Now, what is your treatment for this patient?
See, so
What was that? BP 70 over 100.
100 over
100 over
70.
70.
I
Mm.
think that's pretty good. So vagal maneuvers first.
Man, Danny, you're like dyslexic today, man.
Yeah.
No.
We can OR rotations, man. Back and back.
So, you will not.
Oh no, BP is kind of low.
BP is kind of low. Granted. All right. So if this patient was,
Some people do have BPs like that, though.
it's true. If this patient was 27, sure. If this patient is 57, how does that change your?
Oh, that changes it, yeah. Because that's probably not their normal BP.
So, okay, so
They probably have a way higher BP than that.
Most
if they're
likely.
57. Most likely. They're on
Most
like
likely.
calcium channel blockage or something.
Probably. So how would you treat this patient?
That's probably going to be straight up adenosine then.
Would you give adenosine?
Wait. Oh yeah, I gotta think about this.
Adenosine?
Let me see. They're weak, complaining of some sort of chest pain.
I'd probably give them the
You know what? I'm cardioverting this person.
do the because it's 100.
Uh-huh.
Get an IV going.
You have an
Give
IV?
give them the aspirin and nitro. See what that does. If it still stays up there and they're still and they become unstable, then you're going to be doing some cardioverting here.
If your patient had cool, pale, clammy skin.
I'm cardioverting.
Cardioverting.
I'm cardioverting this person.
Like I need some more like information there, but
Oh yeah, there's more information in the chest.
okay.
What else would you do with your cardioversion?
Sedate.
Oh, sedation, yeah.
Yeah, at least Danny's nice. Danny's gonna at least sedate this person first.
I mean, do you really have to though?
At a blood pressure of 100 over 70, it's really good
Yeah.
practice. If it's like a blood pressure of 80 over 40, nah.
Yeah.
Nah.
Nah? Oh, okay.
Nah, they
Straight
can-
up shot.
Straight
It's
up.
gonna drop it. It's
just-
gonna drop it even more.
Yeah, just smack them with electricity and call it a day. Let's
And
see.
that blood pressure, by the way, is like my wife is 36, and even when she was pregnant, her blood pressure was still 115 over, or like in the low 100s over whatever, like 70. So
She's got some good elastic veins. Is she like a little tiny thing? I imagine she's this little tiny thing.
she's like a $110.
That's why. Because she doesn't need a lot of pressure to move that blood around. Is she short?
Yes.
Yeah. Yes. That's why. She's got a tiny hummingbird heart. That's all she needs. I went to the doctor. I'm 5'2", 140 because I lift. So, and she weighed me. She's like, oh, 140. She takes my blood pressure. My blood pressure was like 110 over 70. She goes, oh, that's really good. I'm like, what were you expecting? Like, thank you for calling me a heifer. Like, Jesus. Like,
And you punched her in the face.
yeah, just a couple more boxing classes and she's done for. All right.
Was she freaked out about your heart rate? Because it's like in the 40s.
Oh, my resting heart rate last night. My resting heart rate last night was 37.
Your resting heart rate is 37?
Mm-hmm.
Holy crap.
Well, I run marathons, so.
She runs like 20 miles a day.
Good for you.
It's like a little on the tipsy side, I can tell.
I'm getting there. I'm just jealous.
You too can have this resting heart rate. All right, cool. If you have a pH of 7.5, are you acidic or alkalytic?
7.5. You are not acidic. You're alkalytic.
Alkalytic, I believe.
Yes.
The higher number, the more basic or alkaline you are.
What's the middle? 7?
So 7.35 to 7.45.
Got you. Oh yeah, so definitely alkalytic.
So remember, your acid right? Your acid base range, your 7.35, 7.45, lines up with your abnormal end tidal of 35 to 45. Tie those
We
two.
see that again?
So your normal acid levels of 7.35 to 7.45 lines up with your normal end tidal levels, which is 35 to 45.
Okay.
You won't forget it. And it also helps when you're trying to figure out, okay, so if I have a patient who has an end tidal of 100,
They'll be optimal.
it's opposite.
They're acidic, right?
They're
They're
acidic.
acidic.
Yeah. So you gotta
Right.
hyperventilate that.
Yep, help them blow off.
Bicarb.
Help them blow off.
Or bicarb, I guess.
You could probably use a
Okay,
little
cool.
bicarb. Cool.
A little bicarb too. Yeah. All right.
Little sprinkle. If y'all want something to watch that doesn't take a lot of brain space, things that I found on Amazon Prime the other day, James May Cook. If anyone knows who James May is, he
That's
is
Top Gear.
The Top Gear James May.
Top Gear. James May has his own cooking
What?
show. Yup, you're welcome. Highly recommended. I think I watched like 3 or 4 episodes, and there was one where he goes, and now we're gonna add some of the Parmigiano Reggiano Cheesiano, and I was like, sold. This is where I'm gonna sit and drink and watch TV.
You know, that gives me an idea. Like Jeremy Clarkson should definitely just bomb that show and just come in and just like do his own thing, be like ridicule him and just be like, dude.
I liked what's his name? The little one.
Richard.
Richard. He was always hilarious. He was my favorite. But Jeremy Clarkson's listen, you've seen my slides. Jeremy Clarkson pops up to tell you all about trauma.
He's hilarious. I love that guy.
So good. Okay. 108, good. 109, also good. 110. So you guys lost your count. Like your lining up is a little fucked now, but that's my fault. So I'm lost now.
We now have a 38-page review booklet.
You could probably eliminate some of it. You could probably spare down your tailor down.
I mean, we take out the 1-page pictures.
No, the pictures are the good ones. Leave the pictures.
How do I learn?
I draw a lot of stick figures.
Only there were pop-ups.
110 on point. Hi. Hello. Can I help you? Roger would like to say hello. Hi. What's up? What's up?
Name? Roger?
His name is Roger.
Bark twice if you're in Milwaukee.
Milwaukee. I want to go for a walk.
I love pets with people names so much.
One of his friends is George. He's the terrier mix. His other friend
I'm a big fan.
His other friend is Baron, who is a German Shepherd.
That's actually a pretty dope shepherd name, Baron.
It is, right? Are you feeling very majestic right now?
Is he pure black lab?
No, he is a get your foot off the table. He's a Weimaraner, pit bull, lab, golden retriever, Dachshund mix. I don't know where the Dachshund came in, but someone got lucky or really unlucky.
Interesting.
He's a psycho though. He chews holes in his own feet. So most of the time he walks around the house with a booty on.
I was gonna say you can use booties.
All right, listen. I got the booties that have the clasp and the Velcro. He's learned how to undo Velcro. I'm out of ideas of how to keep his foot safe because he has a hole. It's this big in his foot on the side that he's just decided, I really just don't like this toe. I'm a chew. You know the people who have those that psychological issue where they think that they should have a limb that's perfectly good amputated? I think he has that. Because he just hates his right foot.
Can you just wrap it?
I have enough vet wrap in this house to wrap a horse. Oh. And he chews right through it. Right through it. Like a psychopath.
Oh,
And this is with Benadryl, Zyrtec, CBD, and anti-itch thing on board. It's just
wait, you
crazy.
can give them Zyrtec?
Yeah, Zyrtec is good for dogs.
Really?
Yeah.
Same thing with Benadryl.
Yep,
Because
Benadryl.
my dog had allergies, really bad ones.
Really?
Mm-hmm. Their dose, I think, almost the same.
It's
Usually like
identical.
20. Yeah.
But don't give them over-the-counter pain meds. That's a no-no.
You know what? I can understand Benadryl because actually, when I flew from Hawaii back to the mainland with my cat, they're like, "You can give her Benadryl."
Mm.
And you're like,
I was like, "Okay."
my cat shouldn't have a better flight than I do. So I see you're drinking what, Captain Morgan? I have a Toscano, fresh
Yeah, I
from
mean,
fresh
just
from
a little
Italy.
bit left. I figured I'd just finish it off tonight.
You know, you can't have that bottle laying around. It's Christmas. You need more room for new liquor.
Exactly.
All
I
right.
think
I think we're good for now. Let's finish here, and I review those things, and maybe look at the second half from like, I'm gonna make a note. It's like number 111, and we'll reconvene next week because I think we all could use an excuse to drink.
Absolutely.
We reconvene next week. Actually, hold on. I'm gonna get to the 15 because I don't want to do the EKG question. So 111. Hold on.
Oh, by the way, next week is it's our last day of class on the 16th.
Oh, that's fantastic! Yay!
Yeah. I think we were all planning it. Who talked to me? We were talking about like going out after class.
On the 16th.
Yeah.
We were like a last day kind of thing.
You should totally do that. Let me know if you guys.
We'll keep you informed.
Please do. Because I don't think I've seen any of you like really in person. So.
Whoa.
Except for like
Whoa.
Danny and Soraya and Joni on the occasion, because I'm at Jamaica. Everybody else is like, you're just floating heads.
Well, first time like in-person impression, you see us drunk. That's
It's a fantastic impression. You're celebrating.
It's not a fantastic impression.
Brian, I can speak from experience from what I hear.
EDP Bree.
EDP Bree.
She's probably turning red right now behind the camera.
By the way, Ashley coined that phrase. I love it.
Just gonna clarify that one a little bit. Come on, highlighter. Okay.
Sodium.
Yep. This is good. Just you have to flip that though, because it records. Chords. Where'd it go? Not electric.
Electric.
God damn it, wine. I feel like that's a slightly less confusing.
I was gonna say, doesn't it go lead 1 on the right, lead 3 on the left?
It's like
2 on the
1 is like across the chest, and then lead 2 is like going across.
The right side, down the right side.
The right. Sorry, yeah.
Right side.
I think. Hold on, I always get Einthoven's. No one put a picture of Einthoven's triangle in here.
I will put a picture of Einthoven's triangle.
Get in there.
It has to be like apex, no? Or am I thinking the opposite?
All right, so wait. Let's go back on that because that's one of the test questions. Where is the apex of the heart?
Ooh.
Bottom.
Thank you, Brianna, for changing your name because that makes me giggle. Yes, the apex is the bottom, as much as that makes zero sense. But you have to understand that it's the narrow, pointy bit. So the narrow, pointy bit is the apex no matter what, even if it's facing down. Have a live, laugh, love, upside down mountain vibe to it, okay?
Mhm.
Anonymous rabbit.
Wait, why doesn't it paste the picture? I don't know how to do this.
I just need you to know that you are the anonymous rabbit. Oh, 115 is correct. Actually, let's just finish this page, because why the fuck not? As we find Einthoven's triangle. Good. All right, cool. 116 is also correct. So we'll start from 117 next week. If you guys have any questions, let me know. Okay. Think we've cleared this up pretty good. And we'll continue on next week. I want you guys to have a bit of an opportunity to kind of digest the information and review it again and continue studying because it is 200 questions. So
How much time? 4 hours?
I believe so, yeah.
The usual time.
Yeah, like 3, 4.
From 9 to like, I think like 12:30 or
Yeah.
1 or whatever.
Something like that. So, but you should be good. You guys really should be super prepared for this. Continue studying, continue reviewing this. And keep asking good questions during your rotations because I feel like that's going to help cement the information in your head even more. Like honestly, I feel like a lot of you took 3 or 4 huge jumps forward in comprehension after having done some good quality ride-alongs, which is great. Like I want to see that. I think you having all of the information up front and then going out was not the best, but was all we could do with COVID. So if you have questions, ask your preceptors. If your preceptors give you crap responses, let me know so that I can put them on the blacklist of people not to ride with.
Cool.
All right. Any other thoughts, questions, concerns before we sign off for the night?
I have an offset question in regards to rotations, though.
Okay.
Are we allowed to pick up, like let's just say, for example, right now we're in December, right? We can technically pick up for February.
Mm-hmm.
So can we technically pick up like rotations after the 14th of our deadline right now to cover our capstone time?
I wouldn't do that.
You know what I
I
mean?
would not
You
necessarily.
know what I mean?
Yeah.
I would not do
So
that.
okay, so hold off on all that stuff until after 14th then.
Ask Scott that.
Yeah, because if
You know
your
what I'm talking
capstone
about?
is due by the 14th,
No, it starts after the 14th.
it starts
I
after the
think.
14th.
He's talking about a field internship, yeah.
Yeah, our field internship part.
You know what? You can probably actually I don't know how this is going to go in terms of what date it is, but you can probably pick it up if you are not quote unquote approved to start your internship. It will just count towards ALS hours. That makes sense?
Gotcha.
I would say wait till Monday and just ask Scott just to make sure.
Yeah,
Okay.
I would confirm because rules change
So hold off for
on
now.
a fairly
Okay.
regular basis without
Okay.
the knowledge of many people.
Gotcha. All right.
Bree, you look comfy in scrubs.
Are we allowed to do that now? Because I know Scott was mentioning
They're not. I don't like them.
you can only do like 1 month ahead now or whatever.
Yeah, I just wanted to pick up like Victor, like 5-1 Victor, and didn't want like since like Pac 28 and other schools are also writing,
Yeah.
then I didn't want people to be like just jamming into like the bus I liked and stuff like that. So that's what I was afraid of.
I gotcha.
Yep, but thank you. I asked Scott on Monday. I'll hold off on it for now.
Write it down. I've already forgotten the question.
Yeah.
Brianna, do you have a question? No? Okay.
Are we done?
We're done.
How's L&D?
It's slow, really, really slow.
Well,
Really,
she literally
really.
sat in the same spot for the last like hour and a half.
It's been 4 hours.
Are you at Southside?
Yeah, I have